Hello, and welcome to our show today where we will talk about Parkinson's disease. My name is Stephanie Paul, and I'm the Vice President of Development and Marketing for the American Parkinson Disease Association, also referred to as APDA. APDA was founded in New York City in 1961 with the dual purpose to ease the burden, find the cure for those battling this progressive neurological condition. Today, we are proud that APDA is the largest grassroots network in the United States serving individuals and families as they navigate this disease. What sets APDA apart from other organizations is our local network of chapters and information and referral centers which provide the boots on the ground. In our show today, we are going to focus on the ease the burden portion of APDA's mission. We've invited a special group of guests who will explain what Parkinson's disease is, how to understand the symptoms that could lead to diagnosis, and most importantly, talk about the steps to take to effectively cope with the disease and provide the best quality of life. Let's meet our panel of guests. We are thrilled to have experts from APDA's Information and Referral Center at New York Methodist Hospital in Brooklyn. The hospital's Center for Parkinson's Disease offers a comprehensive diagnostic and treatment program for Parkinson's disease. Specialized rehabilitation teams work together to develop individual plans for each person with Parkinson's disease with the goal of achieving greater independence and quality of life. First, welcome Dr. Miriam Salgado, who is the Chief of the Division of Neurology, Chairman of the Department of Neurosciences and Medical Director for the APDA Information and Referral Center.
Thank you.
Next, I'd like to welcome Dr. Riquelme, the Director of Speech Pathology.
Thank you.
Rima Kotian, who is a physical therapist and is part of the Metro Sports team and specializes in Parkinson's disease problems and vestibular therapy. And finally, Sapora K, APDA's Information and Referral Center Coordinator. A warm welcome to all of you.
Thank you.
I'd like to start with Dr. Salgado. Every 9 minutes, there is a diagnosis of Parkinson's disease. That means this year alone, 60,000 people will hear those words, "You have Parkinson's." Can you tell us a little bit about what Parkinson's disease is?
As easy as it sounds, it's sometimes a little difficult to give a clear definition because science is ever changing, but I'll make it as simple as possible. We still use the same definition somewhat that Sir James Parkinson's used over a couple of centuries ago. It pretty much revolves around stiffness, slowness, tremor, and balance problems. So we are defining the disease in terms of what you call motor symptoms. And we still continue to do it. So if you have slowness with two of the others, which I'll repeat them, is tremor, stiffness, and balance, and slowness. If you have two of these major manifestations, you say you have Parkinsonism. And if your disease is predominantly one-sided, tremor is present, and there's no other cause that is obvious to cause these symptoms, you can say that you might have Parkinson's disease. So we use this term, but we are trying to diagnose the disease early. So we are trying to bring in more what we call non-motor manifestations to the diagnostic process with a view of diagnosing the disease early than what we do now. So we take things like sleep disorders. There's an entity called REM behavior disorder. There's loss of sense of smell, depression. These manifestations may occur way before the motor manifestations come. So one of the key things is how to diagnose early, but we still define it in a motor symptomatology right now.
Mm-hmm. So who are some of the people who might be diagnosed with Parkinson's disease?
Most of the time, it is the older age groups who are more affected. The incidence and prevalence would vary, but clearly it is towards the older age groups, 60s, 70s, 80s, people have more Parkinson's than below 40. And if you, in the younger age groups, we are thinking more of genetically determined forms of Parkinson's. And the older ages, some of them are genetics, but many of them may not be purely genetic in origin.
So do we know why people get Parkinson's disease?
Good question. So why do people get Parkinson's? Parkinson's is what we call a neurodegenerative disease. That means there's onset and the disease gets worse as time goes on. Just like in Alzheimer's, we have number of Huntington's. These are all degenerative neurological conditions. Why we get is not exactly clear. There may be a number of pathways. Some are genetically oriented ones. The common hypothesis is that you're a genetically susceptible individual who's exposed to something in the environment, such as a toxin, and this sets a process in motion that gets carried on throughout your life and leading to various types of cell death, leading to the symptoms. And some of the initial symptoms, as I told you, there's maybe starting even from your gut nervous system, presenting with something like constipation. You might subsequently get symptoms such as depression, loss of sense of smell, and then in somewhere middle of the pathological process, you might get the other motor manifestations which the original disease was diagnosed with.
So if an individual has either the motor or non-motor symptoms, what should they do?
Well, we like them to seek medical care and attention. And there are a number of research projects that go on with biomarkers, clinical and otherwise, and also imaging, which allows us to make a diagnosis fairly early. Unfortunately, we do not have any cure for this illness right now, and we don't know exactly how we can reverse this clock, although there are some clues that certain things might modify this disease process. So yes, get a definitive diagnosis made early, and from layman's perspective, if you feel that you're not swinging one arm because of stiffness, or you are having a distal tremor, which is a slow tremor which may be occurring at rest, or you're dragging one leg with some tremor phenomenon, tremor symptoms, I would seek medical attention.
Okay. So let's talk about the work that happens at New York Methodist. And you have a comprehensive care team, which I think is really terrific, and it's kind of one-stop shopping for somebody who is living with Parkinson's disease. Dr. Riquelme, I'd like to ask you, tell us a little bit about how that program works and the work that you do at New York Methodist.
So at New York Methodist, we see the patient as a whole, and that's why it's great to be working, as part of a team, because we each add to the diagnostic picture, maybe to the medication management that the neurologist has this patient undergoing. From the speech-language pathology standpoint, we're looking at difficulties with speech, as well as difficulties with memory or language that might impair their communication as well, and swallowing. So we know that approximately 65% of persons with Parkinson's disease will eventually develop either speech or swallowing symptomatology. So what we try to do is evaluate them early on, get that baseline, but also use that time to educate them about little signs, subtle signs, which they need to pay attention to so that they can then undergo a more rigorous evaluation. We also know that about 70% of persons with Parkinson's disease that are admitted to the hospital with upper respiratory problems often have been presenting with swallowing problems for a while. Sometimes liquids going down the wrong way, which we call aspiration, and not coughing. So then for the first time they're diagnosed once they've already been admitted to the hospital. So we'd like to prevent that.
Okay, so is there, once you have somebody come in, is there a way to stop the progression? Or is it just sort of keeping them at baseline from when they have come into you?
Right. So we know that because of the motor symptoms, remember that we have over 26 pairs of muscles in this area. So these muscles are also going to present some of those signs. And so what we need to do is, you shouldn't, just like we say to the patient, you shouldn't live with rigidity. There are exercises that can be done. There's medication for you. We approach their, let's say, speech production in the same way. So let's see how we can stretch those muscles or better coordinate those muscles. Some of the early signs, for example, are low volume. And usually the patient themselves aren't really aware that they're speaking lower, but their spouses and caregivers are. And so we might find out, oh yes, he's been speaking low for 2 years now. And there's remedy for that. Sometimes it's the respiratory muscles that are involved. Sometimes it's the vocal mechanism directly involved. So there are treatments that we can provide the patient with to, again, the ultimate goal, to improve their quality of life.
Okay. Rima, can you tell us a little bit about the physical therapy side of?
Absolutely. Physical therapy plays an important role in alleviating some of the symptoms of Parkinson's disease. Advanced neurosciences suggest that exercise not only may improve brain functioning, but also slow the disease progression itself. And that's why individuals with Parkinson's would really benefit from early referrals to physical therapy or even other exercise interventions.
And what are some of the exercises that are beneficial for people with Parkinson's disease?
There are various techniques that can be used to work on different symptoms of Parkinson's. Nearly 80% of individuals with Parkinson's suffer from hypokinesia, which is slowness and decreased amplitude of motion. And LSVT big is one such technique that can be used to work on specific movement sequences. So many of these patients may suffer from trouble getting out of the bed or standing up from a chair or walking. Seemingly simple tasks, but these exercises can help work on amplitude-driven movement sequences and reactivate those motions.
So that's LSVT big is the program. So
Yes.
what are the components of that program?
Okay. It is a standardized exercise program. It's high intensity. It's a high intensity workout, 4 consecutive weeks, 4 times a week. Their focus is on big, sustained, functional movements that are often chosen by the patient themselves.
So it's if someone has difficulty walking, it's having them to sort of exaggerate
Absolutely
it.
exaggerate, make big arm motions, big arm swings, take bigger strides.
Okay.
That's what the focus is on.
Actually, we looked at evidence-based regimen for Parkinson's, and Rima was one of the co-authors. We wrote this paper looking at all the types of exercises that people can do to improve their functional capacity. And some of the things we noted was wide amplitude movements, quick movements. If you're on a treadmill, treadmill might help. On the other hand, things like weightlifting may not help so much, but it might help things like tremor. Exercises such as you see in Tai Chi might help balance. So there are certain types of exercises which are probably a little bit more helpful than others, and we have looked at the evidence and incorporated some of them into this program.
Well, I would think the most important thing is there are choices because the person has to do the exercises. They have to be consistent with the program, so they have to have something that is enjoyable to them. Sephora, tell us a little bit about your role as the information and referral coordinator.
Of course, sure. I'm going to back up for a second because it's a dual role what I do at Methodist. So there's the part that I play as the Information Referral Center for the APDA, and there's also the role that I play as Patient Care Coordinator for Dr. Salgado's Neuroscience Office. So basically the way that patients get referred for LSVT, big, or speech pathology, they see one of our movement disorder specialists, either Dr. Salgado, or we also have another movement disorder specialist, Dr. Daryl Victor, and they'll come into the office, they'll have a consult, and Dr. Salgado will either prescribe medications, and he'll also give referrals for our different clinicians. And that's kind of how they first get introduced to any kinds of signs and symptoms that they may have, they get referrals for the clinicians. They're also introduced to me, and I provide certain services. I'm there as a support system to provide them with information, with any literature they might be interested in. And I also provide programs like support groups. I have a patient support group and a caregiver support group that meet once a month, and it's an amazing support system. And I've seen lots of great connections and friendships, grow and develop. And I also provide 2 health and wellness classes, a dance class run by 2 instructors that have been trained by Mark Morris, and also a yoga class, which is sort of new to our program, and it's run by an instructor that is trained in yoga, and she used to work in Arizona in the Muhammad Ali Center for Parkinson's. So those are both excellent classes, and as Rima and I think everyone kind of pushed it, exercise is extremely important when it comes to Parkinson's and just general health and welfare in general. And yeah, I think the 2 main components of living with Parkinson's, because you're an individual that's just has Parkinson's. You don't want to suffer from it. So it's all about the outlook and your attitude, and definitely keeping yourself healthy, keeping yourself on a regular medication regimen and an exercise regimen, and yeah.
Well, and I think one of the things that is important is that when someone's diagnosed with Parkinson's disease, they're obviously impacted, but the people around them, their caregiver, their family, and it becomes something that the entire family becomes involved with, and the fact that there are caregiver support groups, the caregiver has to be taken care of just as much as the patient.
Yeah, this is a big issue with a lot of degenerative diseases, whether it's Alzheimer's or Parkinson's. The caregiver, the loved ones take a huge hit. I often emphasize that the necessity for the loved one to take a break. Maybe they should take a vacation in Florida once in a way. Let the children take the burden for a few days. That's extremely important. And I think another very important role that Sephora plays is she's their patient advocate. They call her for anything they want and anything and everything in a way.
Yeah.
Not that she can give everything, but and also she carries a cell phone. So in our program, patients have to be felt that they have somebody to call, and all doctors are usually busy. So she answers her cell phone, and then we'll get back to them. Otherwise they will tell each person or in the team, can you please give this patient a call? This is something that I cannot answer, or I think you should directly speak to them.
Well, and I think that's an important point, the team, and that's one of the things that is very unique, in my view, about New York Methodist and the work that you do. Can you speak a little bit more about why it's so important to have this one-stop shopping for care?
Yeah, if I may elaborate on a little bit. Parkinson's patients have obviously numerous needs and symptoms. They have cognitive issues. Our neuropsychologist is not here on the program today, but we routinely get patients evaluated at a baseline from neuropsychological point of view, because as the disease progresses, when they complain of memory or other cognitive deficits, we know what exactly their baseline was, and we can also offer some remedial measures directly through cognitive rehab or through speech therapy. So the physical aspects, we get the physical therapy people involved. Sometimes they have serious psychiatric problems. A lot of neurologists who do movement disorders would deal with the everyday depression, occasionally the psychosis induced by medications and otherwise. But in our place, the big advantage is we come under a neuroscience umbrella, and I'm fortunate to give leadership to the effort, and therefore we have rehabilitation, psychiatry, psychology, speech and language pathology, everything coming under one big umbrella. So we offer a kind of a coordinated approach.
Right. So the patient can come one place
and get everything. Yes. And she will basically direct them and make sure that the things get done, and there's somebody who's looking after your interests. And if it's also, we offer things like diagnostic tools like DAT scans, which Methodist has been one of the first 40 centers to start doing DAT scans. We do a lot. When we are not sure about the diagnosis, it's one of the few tools we have for the diagnostic process, or whether they want to get an MRI, particularly to rule out other diagnosis, and she coordinates all that.
Yeah. So it's we all the clinicians from that are involved in our program meet once a month to discuss the patients that have been on a seeing our team on a regular basis, and just the communication is extremely important for a full
and sharing our being able to just walk into each other's offices or pick up the phone and call or look in the electronic medical record because we're on the same system allows us to be able to communicate as well as share sort of maybe some signs and symptoms we picked up that might impact, let's say, Dr. Salgado's decision making when it comes to managing medications, or something that comes up with a caregiver that maybe they should talk to Zipporah about. Or also looking at progress. Rima might be working on something, not getting very far, and I'm finding the same thing with either their speech or their swallowing therapy. And so that communication is really important.
So tell me, in your observation, we know there are 1 million people, or it's estimated that 1 million people are living with Parkinson's disease in this country. Is there an increased number of diagnoses, or tell me a little bit more about that?
It might be that we are more astute at recognizing the illness, because organizations like the APDA has made it more aware. So rather than saying, my grandmother had a little tremor and she's slowing down because age is catching up, you might make a more definitive diagnosis. There are certain trends in certain ethnic groups. You'll find that Parkinson's, the prevalence is higher. We don't know, it might be, there are immigrant groups, I see some of them seem to have a higher prevalence, but a number of studies being done. But overall, people are living longer. So we are obviously, just like in Alzheimer's disease, we find more people getting affected primarily because they are living longer, and this is another illness like that. So. And
what about people being diagnosed younger? Because I think it might be thought of as an older person's disease, but we're seeing more people who may be diagnosed under 55.
We have groups of patients. Some of them probably are inherited in an autosomal recessive fashion. As a general kind of rule of thumb, if you see somebody who's getting young onset Parkinson's, by definition below the age of 40, there might be a greater chance that it be some form of a genetic components might be playing a much more important role. Let me put it that way. And pure genetic forms are also there. So many genes have been diagnosed to cause Parkinson's. So the young ones also, some of them are exposures to various toxins and chemicals. And we know the MPTP story, which is a form of heroin that the drug addicts used to cook in the West Coast, which caused very acute onset Parkinson's, which we really use it as an animal model even today for research purposes. So we don't know what people are getting exposed to. Right. And some of them may have, inflammation might be playing a big role as well. Autoimmune basis is coming more and more being highlighted. Is there an autoimmune process? And some of these cases very well could be. We do not know the initial onset, what triggers this process. Once it triggers, then it continues to go. But the origin can be multifactorial. And we are probably seeing this whole kind of a syndrome, and what caused it might be many reasons. So.
But the key then is for people to, even if it's a non-motor and they would see a non-motor symptom, presumably before a motor symptom, is to get to a neurologist and get a proper diagnosis as quickly as possible?
That will clearly be useful. And as Rima was trying to point out, very vigorous exercises have been shown to possibly to slow the progression, clearly in animal models. So in humans also, in clinical practice, as a practicing physician, we see the people who really exercise well do seem to better, and that has been shown in a number of studies. Whether it's dancing, whether it's specific routine of exercises, or whether it's treadmill, they seem to maintain their functionality better than people who don't. And there has been certain amount of work being done on various neurotropic factors which will increase cell survival. So therefore, you are probably having some kind of a protective benefit with at least exercise. Some of the medications we are not so sure, and none of them have been ever, FDA has still not given any labeling that these drugs cause any slowing of the process, but exercise clearly might be one of the more important ones.
And so as we're seeing, the aging population grow, when we're looking at neuroimaging, we've seen that also with the Lee Silverman voice therapy, loud, that we see in speech, and actually seeing other parts of the brain being activated, specifically the right frontal regions. So there are changes going on with some of the treatments that are being provided to patients. So someone can improve their quality of life because we are addressing some of the changes that are needed in the way their brain functions so that they can maintain that balance and maintain function. So whether they're diagnosed early or they're older, it doesn't mean they have to lose that quality of life simply because they've been diagnosed.
Right, so people shouldn't be afraid. They should know that there's help out there and they can be optimistic about a diagnosis. So if you had one message that you want to give to our audience about Parkinson's disease, what would that be?
I think you should not shy away. There are a lot of people with disabilities, and my message is that it's easier for one to handle any illness for that matter if you accept it early and do the needful. Do not have to be in denial. If you if you think you have symptoms, seek help, and possibly it's very likely that you'll be able to lead a functional life for many more years and never give up and think positive.
And you see that that works?
People who think positive,
works.
clearly
Oh, yeah.
they do much better.
Yeah,
Oh, yeah.
yeah, absolutely.
And they're not alone. I mean, you have this, and there's so many other, opportunities and programs, and there's so much out there. You just, you have to look for it, and we're here to help. And there's just seeing in the support groups themselves, there's just so much out there, and there's so many people who are willing to help and, and listen.
Absolutely. Yes, well, thank you. And that's why we're here today, to share that message. So thank you all.
Thank you.
And I want to remind you, APDA has many free resources for people with Parkinson's disease and their caregivers throughout this country. We encourage you to visit the APDA website, and that's apdaparkinson.org, to get connected to these resources. We also ask you to keep a lookout for our public service announcement, Live with Optimism, which is running on television and radio throughout the country. This campaign is meant to encourage individuals to visit a specialized website, apdaoptimism.org, to gain immediate access to Parkinson's resources, to learn more about the disease, and share their own stories as a person with Parkinson's, a care partner, or a healthcare provider. We'll be showing you the 60-second spot at the end of today's show. Our thanks to our special guests, Dr. Salgado, to Sephora, Rima, and Dr. Riquelme. Thank you so much for being here today, and thank you to New York Methodist for the work that you do and how you're able to help us ease the burden, find the cure for so many. And again, if you would like to learn more about APDA, please visit our website at apdaparkinson.org or call 800-223-2732. Thank you. And thanks all of
Thank
you
you
for
very much.
being here.
Thank you very much.
That was very helpful. I think, yeah.
Parkinson's disease is a neurological movement disorder affecting an estimated 1 million Americans, including many under age 40. It has no cure. Parkinson's is not limited to how a person moves. It can also cause symptoms like depression, fatigue, and impaired speech. Today, there is a new diagnosis every 9 minutes, though Parkinson's can be present for years before being diagnosed. The American Parkinson Disease Association is the largest grassroots network in the United States, working to help ease the burden and find the cure. For more than 50 years, APDA has funded pioneering research and provided critical support to those affected by Parkinson's. Visit apdaoptimism.org today to find out how you can help millions live with dignity and optimism. Your action today will help APDA put an end to Parkinson's disease.